In her late 30s, Michelle Barraclough thought she could conceive her second child naturally, but by then it was too late.
I had Jack in 2003 when I was 34, and it took me, obviously I wanted to wait a couple of years before having another child, and I just thought I'd fallen pregnant naturally once. It'll happen again, nothing wrong with me. And so it just didn't, but then it just didn't happen.
Michelle ran for tests, and it was concluded it was unexplained infertility. This was an uncommon experience for Michelle. She pursued onto IVF in hope for conception.
But it wasn't until I was about 41 years old that I was talking to a friend of mine who was 48, and she had tried to conceive a second child as well and hadn't had any luck with IVF. And she said to me, you have to decide if you really want a second child, and if you do, you have to decide now and do something about it, like IVF. And I'd never thought of IVF. I always thought IVF was for infertile couples. I'm not infertile. It just didn't kind of sink in that I was infertile at that, for all intents and purposes, couldn't fall pregnant. So after talking to her, she said, you still have options at 41. At 48, I no longer do. So just bear that in mind. So I went straight home, jumped on the internet, found Sydney IVF, which is now Genea, asked around a few people who was the best doctor, got that doctor's name, made an appointment.
Pregnancy problems affect women who are getting older. For women like Michelle, who can't fall pregnant naturally, IVF becomes the main treatment. There are IVF clinics that can provide them the support they need for a successful conception.
So people usually try and conceive for a year or two perhaps, and then they get investigated by us, and then IVF can help them get pregnant. I do, again, a doctor sort of surgical thing where we collect eggs, then the scientists look after the eggs and fertilize them, and then when they're ready I come back with a patient to put the fertilized egg back. So it's a process that takes about a month for a cycle.
About 60 to 70% of cycles that produce embryos fail to implant. Michelle found out after much patience that her first cycle failed. It was until then that she decided to pursue acupuncture to support her IVF treatment.
In my head I was thinking, I just set myself up for failure, I haven't been proactive about this. I've just been leaving it all in the lap of the gods. Well, I decided that with the second round that I was going to be a little bit more proactive, both mentally and get a better attitude. This is going to work, and I'm going to fall pregnant, and I started to really visualize it. And I also decided to try acupuncture as well, just to give myself the best chances. So I found a very nice acupuncturist in Manly called Jenny Huang. She always started off with a massage, then she'd put needles all over my body and legs and into my forehead. And then afterwards she would give me advice. And that round was successful. So I found out that I was pregnant from this frozen embryo that had been implanted. And I just kept going to see Jenny every single weekend. So once a week. And then after I got past my 12 weeks, I started to go once a fortnight. And I saw her through my entire pregnancy. I was too scared to stop going.
The reason most sex fail, we think, is primarily due to the embryos. The embryos can often look normal but have genetic abnormalities, and humans seem particularly prone to this. So the embryos can have chromosomal imbalances, and acupuncture fits into that category. What else can I do? They all want to do something. But in reality, there's a lot of things to assess. It's not just a matter of are you feeling good? Is your body in balance? Or that concept.
A current study undertaken by IVF Australia and Dr Caroline Smith from the University of Western Sydney investigates the effects of acupuncture on IVF. The study involves 1,400 women under the age of 43 and 6 IVF units around Australia and New Zealand.
We would invite women who are currently undergoing an IVF cycle to join our study, which would involve having 3 treatments during an IVF cycle, with the aim of trying to see whether it could assist with increasing the number of live births. And to do that, we're going to compare a group of women who has acupuncture with a control group, which is like a placebo group. And that will enable us to compare those two groups.
A lot of women find it enormously helpful. There's the what we know is that acupuncture reduces stress hormones, and we also know that stress reduces fertility rates. So that's one way that acupuncture might work. We know that it improves blood flow to the ovaries and the uterus, so that's another way it might be helping with implantation or with good ovarian response. And we suspect that acupuncture has some sort of immune modulation effect.
I felt complete as a woman, as a person. I felt like my life had come around full circle, and yeah, that's it now. I'm done now, you know. I felt very complete, which is a wonderful feeling. That feeling of having failed had just completely evaporated.
For Michelle, acupuncture on her IVF treatment was a success. Yet there is to be more research to expand on the relationship between acupuncture and IVF.